And I have a few questions before we go to our feed. If there are any questions, just feel free to post your questions on our chat or our question box. Let me just check if there are. Going back, how does your experience as and your exposure to it affect how you report your news or how you present these stories?
Yeah, thanks, Jake. That's I think a good place to start because, like I said in the presentation, I have my own drug using experience and even my own addiction experience that I'm fairly open about, and I've written from the first person and have talked about my experience in treatment and I think what I have really learned over the years is that my own experience is quite limited, actually, and that there's such a vast spectrum of drug using experience and addiction experiences. And mine, like I said, is very narrow, and so I really try to not rely on my own experience when I'm writing stories about other people. I really, I seek out other people's stories because I find them much more interesting than my own, to be honest. And I think that a one kind of theme I often see in America's recovery culture, at least, is that the first person experience is weighed quite heavily, where people who have experience, of course, they deserve to share their stories, and I'm always thrilled when I see them. However, just because someone has experienced something, it doesn't make them an expert on it. In fact, I often hear people with their own addiction stories, kind of bleed into misinformation because they're only relying on their own experience and they're not extrapolating outside of it. So I really find that in this whole work that I've been doing, that the the science and the researchers and of course people who are currently using drugs and currently going through addiction, those are the sources I rely on to find stories and report solid, up-to-date information, because my own experience is also outdated. So I think that's just kind of my own stance on where my experience ends and where my professional work begins.
Thank you. What I'm getting up from that is it is important to balance your interviews with current science. We have to mention that always. That's part of the dynamic in reporting this. I understand that there's also a level of trust that you are privileged with being having an experience of on it. How can media earn the same level of trust if they don't have the same exposure and experience as you?
Yeah, that's a really good question, because right now trust in mainstream, the, that's almost like a slur, mainstream media at the moment, and people don't trust it. And and I think I don't want to totally diminish the rationale for why they're mistrustful. And so I think one thing that I mentioned in the presentation is that for decades, drug use and addiction were often covered by crime reporters. And there's even a kind of a culture of writing called true crime, for instance, that is very popular right now. And there's these stories often rely on a series of conventions and tropes, and they're often quite gritty. They might have black and white photos accompany them. So I think if the media will invest much more heavily in behavioral health, in public health, in mental health, journalism, and hire journalists who have expertise in these fields, the stories will be much better. And the journalists will find that if they, don't rely on the cliches and the stereotypes, and they truly present someone's humanity, that more people with this issue will come forward and want to talk. And that's just something I've noticed in my own work, is that when I present someone's story compassionately, other people will come to me and say, thank you. I would like to, share my experience with you now too. Whereas if the coverage is, outdated and relying on a lot of old language, then people are really turned off by it.
Thank you. You mentioned earlier crime reports, and I'd like to highlight and press more on that one, as that's actually very relevant on stigmatizing, and it's also the case here in the Philippines. Our public and our media consumers' view of drug users is heavily linked to those images and of crime, that these people who use drugs are addicts, they're rapists, they steal, they kill people, and it brings me back to my really basic journalism training in middle school, wherein our the way we write it is we just use the five W's and one H. And when it's the who, you just have to mention the name and he's an addict. And if it stops there, it doesn't give more context. How do you suggest we do crime reports and being fair to the narrative of these people and of drug use, and how do we destigmatize it when it comes to crime reports?
Yeah, it's a good question. I mean, absolutely. At least in the US, I know for sure that local news invests a lot in crime reporting, and there's police blotters, and it generates a lot of clicks, a lot of advertising revenue, because these stories are pretty much copy and pasted from public records, police reports. And so it doesn't take a lot of effort to do, and you can generate a lot of clicks and revenue by sensationalizing what might otherwise be a somewhat mundane crime, right? Where, like, I'm reading about, I don't know, I don't even want to give a hypothetical case because it'll be bad, but if I'm reading about crime, I'm wondering, as a media consumer, why is this newsworthy? Why is this crime on this day committed by this person getting its own news story? And oftentimes, like, celebrities will hear about their car accidents and arrests and drunken fights and all this stuff, and that's a whole other can of worms when it comes to public figures. And I think when it comes to lay people, who do find themselves being written about because of a crime they committed, I think, and I've talked to people who've been on the end of this thing, and uh, they just have they just feel tremendous shame and embarrassment, and it absolutely makes their lives worse. And so there's one thing that a few publications in the US are starting to do. I think the Boston Globe is one of them, where if it's basically like forgiveness. It's erasing old crime stories, where if your crime was reported on and featured, you can reach out to the publication and they will, scrub your name from the record. And I think it's in line with a criminal justice reform kind of movement right now that really does emphasize forgiveness, even among people who did commit crimes, even among people who have been violent in the past, where that doesn't mean they're not human. It doesn't mean that their stories shouldn't be told. I think crime reporting has a long way to go, but I think one thing that I always try to kind of stick to is like, am I doing extractive journalism? Am I going into a community and pulling out all of the dirt that I can then present to the world? I don't want to be extractive. I want to be collaborative. I want to communicate what people and communities, even if they're in legal gray zones or on the wrong side of the law, I still think that they're human beings and deserve to be heard and not judged and shamed.
Now, you mentioned earlier that a practice that's really an interesting take on scrubbing because it's also linked to our rights in data privacy. It's somehow there's a movement of it. CCPA, GDPR. We also have that here in the Philippines, and that's an interesting take. And you can request them to take down news about you. That's interesting. That should be revisited, I think. And how could we replicate that here in the Philippines? And if do we have the right to do that? Because there is, and on the other side, there is freedom of expression and there's freedom of the press. How do we, where do we put ourselves in those two kinds of freedom? And my private freedom as an individual who's being reported, and freedom of the press in reporting.
You're asking me, that's a very intense philosophical question. I don't know if I have the right answer to it. I think that journalists, I think, have to know how much power that they wield, and that the platform and power I have working in the media, it's not, I'm not playing on the same playing field as a layperson who just got their third DUI and is now finding themselves in a crime blotter, and then that story filters up to some further reporting. Like, the power imbalance is quite uneven in these instances, and I think it goes back to really the basics of journalism, which is like, why is this story newsworthy? What are the potential downsides of going all in on this story and putting this person on blast in public? And I think it varies across the media landscape right now. And I think mostly because of Twitter and because of like the direct feedback that readers can now give to publications, that publications feel like they're put on notice now much more, and that the discourse is much more, even if it's not great all the time, much more rapid and biting. And so there's a way that feedback straight to the newsroom is direct in a way that it wasn't before. And so I think it really does come down to balancing all these various different kinds of power, and really remembering why'd you become a journalist, right? Like, I didn't become a journalist to write about, yeah, like people on the worst day of their lives and trying to rake them over the coals for it.
Thank you. Thank you. Let me just go ahead and go to our chat questions. Let me just read one. Thank you for the useful guidelines and tips. I remember you mentioned earlier the three pillars of drug coverage, and I appreciate that. We'll review that in a bit. On another note, how do you avoid romanticizing drug use and drug addiction? What are your thoughts on the significance of the preventative approach in harm reduction?
Yeah, I'll take the last question first, and I do I practice harm reduction as a journalist. Like, I really truly do not want to cause harm to the people I'm reporting about, unless those are incredibly powerful people who deserve it. In my eyes, I mean, that's something I'm not afraid to do or say as a journalist, and especially when it comes down to having like a lot of evidence on my side, I feel quite emboldened to punch up, and I really try hard not to punch down. And in the first question, romanticizing drug use, there's always a draw to do it. I think it gets back to the crime reporting. It gets clicks. It's gritty, it's edgy, it's sensational, and it's entertaining. And I think I've gotten much better at it as I've gotten older. To be quite honest, I think when I was younger, reading uh, Hunter Thompson or William Burroughs, reading these guys who did romanticize their drug use, I think the the conditions in the U.S. right now make it quite easy to avoid, because um, when I'm focusing on my addiction writing at the moment, it's usually in the context of our national public health emergency and digging into the statistics there and the science. I find there's not much romantic things happening there. It's quite grim.
I have to go back and appreciate your how you use your data story. It's not just the more boring bars and lines, and you presented it well, and that's really important in media. Sometimes it's really draining in the eyes of the public if we see just bars and lines, and it's uptrending. Thank you for highlighting that also. You also mentioned that you practice harm reduction as a journalist. That's an intriguing, and that's the message of one of the messages of this session or this summit is actually harm reduction is for everyone, not just for drug users. And the, journalists can do that to be very careful of their people stories. Thank you for highlighting that. Let me just check on another. Um, Compared to the past, has there been any significant change in media reporting in the U.S. on harm reduction and on drugs as a result of your advocacy efforts?
Um, it's hard to directly measure the impact of our own project, like changing the narrative. I think it would be great to team up with researchers who can, quantitatively analyze change over time, and like using certain words as keywords to kind of measure their prevalence. And I think one of the big changes, though, that I think has had quite an impact was in 2017 when the Associated Press updated their style guide entry on addiction, and they explicitly said, use person first language the same way we do with other illnesses. So even diabetic, it might not sound stigmatizing because diabetes doesn't always carry a lot of baggage and stigma, but you can just say so and so has diabetes, or so and so was diagnosed with type 1 or type 2 diabetes. It's presenting the person first and the illness or condition or whatever it is afterward. And I think that trend has really taken off. And I think among myself and a lot of my friends and colleagues, we're all millennials. We've all been writing and doing journalism for a while now. And I think we have made a big difference in how the media covers this topic, especially over the recent years. And especially if you want to take the long view and be optimistic, those headlines I showed from the New York Times and from other publications back in the late 19th and early 20th century, those headlines were brutal and they just wouldn't happen today. And I think while that does present progress, it also has to make us be vigilant of coded language, of the ways in which that there's dog whistles, there's language out there that might appear to be urgent and compassionate, but really it's reinforcing the assumptions driving the drug war. It's reinforcing a lot of the kind of repulsion that people feel when they hear about drug use and addiction. So I think it's like I want to say I'm an optimist tonight. I'm feeling and think that we have made a big difference, and not just me, but a lot of people doing work right now. And so I think in the U.S. at least the discourse I think is moving in the right direction.
Yeah, I totally understand that it's difficult to measure one's influence over change, but uh, and and as like you mentioned earlier, it's not just about political correctness. It's really about being careful on the language and being willing to adapt to better language, to change with your better language. There's a movement for it. Like for our for Latinos, there's Latinx and Filipino Filipinx, and we just have to be more open to using better language in drug use and covering it. Uh, Let me just check more.
Looks like there's a lot of
There's
questions.
a lot of questions. Uh, where can local media outfits, companies being in review or rethinking the way drug use is narrated or written?
I'm just reading the question myself
Sorry.
too. Yeah, I definitely think that local news is actually quite critical and it's often overlooked. And a lot of the more stigmatizing images and headlines that I've pulled over the years actually do come from local news outlets. And there was another study analyzing how medication treatments for opioid use disorder are presented in the media. And I didn't put this study in my slide, but I'm happy to share it to whoever wants it. Just ping me after this. And it found that local news outlets, especially in more rural areas, presented a much more negative slant when covering these drugs that save lives. And the articles often neglected that these drugs are life saving. And I think one of the kind of, instead of just blaming local news reporters for not knowing their stuff, I think there's a much more important structural explanation behind it, whereas local news does not have the resources to hire health and science journalists the way they used to. And so they have only a few general assignment reporters that they then send out to cover all kinds of different topics. And really, I think everyone here, everyone listening to this knows that it takes so long to truly understand the complexity and depth of drug use. And that, like I was saying before, it's just there's so many different experiences, and it occurs on such a wide spectrum that I always know that whatever I'm presenting, whenever I'm quoting one person, it's just one person. I'm not trying to turn their story into this vast kind of
Public issue.
exactly. So I think what it really comes down to
I
is investing in the expertise to drive a different narrative.
Thank you for saying that. We actually have someone from the local media, and I think we can. He asked a question, and if I think we can bring up him up on the stage to ask the
Right.
question himself. This is really a great opportunity to share and to ask questions. If you have anyone from the media who would like to ask questions, please reach out to us, and we can bring you up on stage. Dewey. Sorry. Let me just go. While we're preparing on that, let me just check. Let me just ask: how do you address the study that posits that conservatives don't respond well to data, evidence, and statistics?
Um, yeah, that's actually something I don't quite know how to wrestle with. Um, I mean, I think whether I don't know exactly which study it is, though. For sure, all of our own ideological priors and our own ideological assumptions going into things color our world and our perception and how we present things. And I know that I have my own biases and my own ideology that, I'm not trying to force down anyone's throat, but when it comes to science, and I think in this case, in this context, maybe an analogy of like how there's climate denialism among people on the right today. I mean, I think it's, again, I try not to focus on changing individual hearts and minds. I think the level of analysis that I like to kind of hover at is, why is there such a well-funded campaign against climate science? And I think there's a lot of moneyed interests, a lot of corporate interests that fund campaigns. So I think as media consumers, it's about knowing those kinds of structural dynamics at play here, and knowing that for at least in the US, 40 years of funding to subvert the science on climate, or funding to reinforce prisons and jails as the primary tool to address social problems. And I think going to that level of analysis, it sort of becomes moot as to whether or not someone's conservative or liberal or what they believe or don't believe. It's I think there's units above the individual that make things become much more clear.
Yes. Well, maybe we can talk more about that and maybe make it a more meaningful discussion with a member of the press, local media. We have here Mr. Howie Severino from GMA Network. Thank you for being with us, Mr. Howie.
Hi. Hold on. Let me try to turn on my video so
Hello?
I'll see. Hi. Hello, Zachary. Thank you for joining us. I'm sure it's an ungodly hour wherever you are. I think you're in, where are you? Chicago? Okay. Uh, I'll just make this. I'll try to make this quick, although it's a very complex a topic. And thank you for triggering a lot of thoughts. Some of the issues that you highlighted actually have been continuing problems, right? But in more recent years, um, the coverage of drugs, of course, I'm sure you've been following to a certain extent what's going on in the Philippines, the drug war, etc. It's gotten a lot more complicated because I think some of the your suggestions, recommendations, I mean, they're very sensible, but there's a huge assumption uh, that there is good faith in wanting to solve the drug problem, right? Whether you believe it's a public health problem or a criminal problem, I think there is an agreement that there's an agreement that, the drug problem needs to be solved. But among those of us, I mean, I've been covering the drug war here since 2016. And there's been kind of a growing belief, not just with media, but people who have been paying attention to what's going on in the Philippines, um, uh, that one major objective of what's going on here is not really to solve the drug problem. It's part of a political project, right? I mean, many of us who have been covering this issue, the drug war in particular, have seen very, very poor people uh, just killed in their homes, bodies found on the street. And then you bring out all the data and statistics that show that this kind of approach will not work. It has not worked in Thailand. It didn't work in Mexico. It didn't work in Colombia. It didn't work in the United States, et cetera, et cetera. They're not paying attention. So yeah, we agree that science is important, expertise is important, but um, maybe we're all preaching to the choir here. We all kind of agree because there are people out here in the Philippines who know what the experts are saying, And it doesn't matter.
Yeah.
Yeah.
It doesn't matter because the goal may be other than solving the drug problem. You get what I mean? It has helped create a climate of fear uh, uh, everywhere, even and it may be especially among media professionals. So I guess that's part of the dilemma. We may agree on changing the language, on showing more compassion, etc., and then there's going to be immediate pushback. Those of us who have been advocating a more compassionate view of drug use, of the drug problem, of seeing it as a public health problem. We're trolled, we're threatened, we're intimidated, we're harassed, we're sued. Um, it's like, I don't know if this is a good parallel, but it's like the Trump administration's demonization of immigrants and foreigners, where the problem of immigrants causing crime, causing social ills, etc., were greatly exaggerated to serve.
It's a pawn for a larger ideological project.
Exactly.
Yeah.
Yes.
So exactly. So it's part of a political project. All of this rhetoric, all of these, the wall between the U.S. and the Mexico, it wasn't really meant to solve the immigration problem, right? We know that. It's pretty
The
clear by
U.S.
now.
created the immigration problem, so.
Yeah, exactly. It's somewhat, of course, the drug problem is very different from what I'm talking about in the U.S. But what I'm saying is, let's not fall into the trap of assuming that there's good faith on the part of everyone wanting to solve the social whatever it is, the social problems that governments are claiming they want to solve, when there are completely different goals.
Oh, I absolutely think in your context specifically with extrajudicial killings in the street, that's not even a drug war. That's murder by the state, right? Like, I think I often find myself pretty repulsed by the idea that Duterte is a drug warrior. It's like, no, this is genocide. I mean, I don't know. I think it's murdering people, and if that's part of a broader agenda to wield electoral power and stir fear, then yeah, playing on their linguistic terms and playing on the field of let's talk about drugs and public health and look, our side is right and your side is wrong, that's definitely not going to work here. And it also doesn't work with a lot of ideological opponents to criminal justice reform in the US either, who do not want to see their social status and their power diminished. That has nothing to do with drugs. That's about such a bigger political problem, right? So I think in the context you're coming from, you're absolutely right. It's sort of a fool's errand to present the data with someone carrying a loaded rifle. Like, that's not going to convince them.
Well, we're running out of time and we're limited, but let me take this opportunity, since we're with Mr. Howie Severino. Let me bring you into our discussion earlier. We're in reports, in beat reports. It is actually really highlighted. These are drug addicts. They do crime, and you being a reporter and at the same time a documentarist, wherein in documentaries we give better context to the lives of these people. How do we, and you use better language there, how do we translate that in beat reports?
Um, just through education, and through from doing what you're doing right now. You just have to create all of these conversations. A lot has changed. I've been doing journalism for the past 30 years. Don't get me started on comparing different eras, but we can look at everything half empty, but being my age, I tend to look at things half full because I've seen it much worse in terms of the media, not in terms of the politics, but in terms of how media has treated minorities, have treated the LGBT community, have treated when I first started in television, we used to show all the children's faces. We used to show the faces of suspects, of crime suspects. We used to, I mean, it's actually improved. But I totally agree with all of you that there's a lot of room for improvement. But I think a lot has already improved, in at least during my career, because of conversations like this. And we just need to continue. We just need to be patient with this process. But I mean, Tristan, you look young enough to be my son, right? You don't know those years, so I want to assure you. That in terms of media professionals, the current generation is much more woke, is much more aware. I mean, journalists your age, they're much more progressive. They're much more compassionate than journalists your age when I was first starting. So we could go on and on about what else needs to be done, right? But I think I see progress in the journalism profession, all over the world, actually, and I just hope it continues.
Thank you. Well, let's entertain one last question before we end this. And please answer this. Please feel free to answer this both. What is the incentive and risk for media to shift the narrative from war on drugs to harm reduction while we are still in the middle of this war?
I'll just try to take a stab at it because I think I touched on it a bit ago, where I think that by telling better stories that are much more grounded in humane reason and compassion, that people will want to talk to the media more. The media will be able to tell better stories, and I think I've talked to so many people who've been burned by the media in the past for outing them, or for stigmatizing them, or for a number of reasons. And it makes people distrustful of the work, and it makes all of our jobs trying to tell these stories that much harder. And so I think by really the incentive for me, at least, is to just get better stories out there to people. Like that's really, at the end of the day, why I do this work. There's no end to it. We just have to keep going, and I think that's really the drive for me is exactly that. This doesn't end, and you're right. We do need to keep having these conversations and keep going. And I don't think there's going to be a day where it's like, okay, the drug war is over, I'm going to pack my bags and go home. I don't see that happening anytime soon.
Well, it starts with a ripple. Zach, I'm sure wherever he is, he's kind of the tip of the spear, right? Some of us have to be the tip of the spear in making change, whatever change it is. And for the longest time, this is what media has been doing. And I mean, I've tried to be a tip of the spear in whatever I've been doing. But I just I do documentaries. I don't do daily reports. Part of the problem is it's really the climate right now. If you try to change the language, if you try to espouse a different way of looking at drugs, you'll be demonized. I mean, we've been called. I mean, my colleagues and I have been called pro-criminal, pro-drugs.
Yeah.
If we show a bit of compassion for drug users, it's looked at as being anti-government or anti-drug policy, anti-drug war. Therefore, you are it's kind of a black and white thing. So you are pro-crime, pro-drugs, etc. And that's very intimidating. for a lot of journalists. The easy way, the path of least resistance is just to kind of go with the flow and not put yourself and your media organization in trouble. As we know, media organizations in this country have been shut down. Lots of Filipino journalists have been killed. Activists have been killed. There's all kinds of crazy things that have happened in this country, and the result of that is basically a lot of intimidation. So that's a big obstacle to change. But as I said, you need people to have this kind of conversation. I'm sure everyone involved, not just journalists, everyone who's tried to change the conversation, trying to change the language about drugs in this country, at least, have taken risks. I'm sure if you posted some of these sentiments on Facebook in public, you're going to get a lot of pushback from ordinary people, right? We know that. We all know that. And everyone has family members who are like that, right? I have people in my own family who believe the government line that drug addicts need to be demonized and jailed and even killed. They're less than human. There's this whole language about that, and we need to push back wherever we are, in our backyards, within our families, within our media organizations, and in public. And there aren't that many people who are that brave in this kind of environment, where you can actually get killed for, just as a simple example. I know we don't have a lot of time, but one of the stories I covered was about this kid. He was a disabled kid, the son of an overseas Filipino worker, and his mother, who was a domestic helper in Kuwait, had to rush home because he was killed. He was put on the drug list by a neighbor whom he had an argument with. Okay. And he was accused of being a drug runner. And this kid was disabled, right? So it was impossible for him to be going around the neighborhood selling drugs. It's that easy. It's that simple to get killed here. So if it's that easy to get killed here, it's also that easy to just look the other way. It's just so much easier to not be brave, right? That's why these occasions have to increase. We need to have more and more people involved in this kind of conversation. I noticed in the participants list there are people with the Department of Health. There are people in government, local government, not just civil society, not just advocates, but people who do like daily work, dealing with ordinary people. They need, they're part of the tip of the spear. They need to be changing the language about all of this. And I'm glad that you're bringing this kind of perspective, Zach, from overseas, and Tristan, your group. So thank you. We hope to solve not just social problems, but really reduce the brutality that's happening. It's actual. We're dealing here with not just drugs. We're dealing here with much larger issues. As Zach mentioned, it's more than just a social concern. This is a political concern, and it's global. It's global.
It is.
There's this one last point. Really, this is to us here. This is part of this global struggle between democracy and the opposite of democracy.
Yes, it is.
I don't want to dramatize this, but that's really what this is about, right? Whether it's demonizing immigrants, in the U.S., or demonizing Muslims in Europe, or demonizing drugs in the Philippines, whether it's demonizing cultural minorities in China, whether it's et cetera, et cetera. This is really about whether we're going to have a pluralistic democracy where people have human rights, or we're going to have a future without any of those things. Right?
Yes,
It's much bigger than just drugs.
It is. It is. and in terms of democracy, the people did not just vote for the person. The people voted for the idea. The people voted for the campaign. And how do we put ourselves into that risk? And in speaking of risk, what is Zach? What is your advice to us here in the Philippines and to our media? Where can we start in these changes that you're proposing, where we can um, put some level of risk, a safe level of risk, without being called biased?
I mean, I don't think I can dish out advice to anyone in the Philippines covering drugs, given the level of brutality and, truly you all have skin in the game where the risks are not just, you're not just going to get canceled and lose your Twitter following. You could get killed or disappeared or whatever. And I think that having that weigh on you while doing this kind of work. I don't know what that's like. I've never faced that level of risk in the US. And I mean, like, we are the country who elected Donald Trump 4 years ago. Will always be that country, and there will always be people in this country, a significant swath of people in this country who want brutality, I think, and I think in in my work, I guess I'm just incredibly lucky that I don't have this, don't face these kinds of risks that you're all facing in the Philippines. So I just frankly don't think I have the ground to stand on to dish advice about it.
Oh, well, we appreciate everything that you shared. Maybe we can start with your three pillars of drug coverage. Can you review us on that? What are your three pillars of drug coverage earlier?
Let's see if I even remember. I think first it's always stick to the science. Second is don't be afraid to question assumptions and go against the grain. And like you said, be the tip of the spear. Don't be afraid to do that, though. In your context, there's plenty of reason to be afraid and to go with the flow. So I think it's incredibly brave for anyone to go against the dominant ideas and what's popular. It can be a very lonely and isolating place to go against the grain like that. And then lastly, and I think this goes for all journalism and for anyone working in this field at all, is to really truly cherish the trust that people hand you, because I know I can't do my work without it. And I think a lot of harm reduction services also don't work without it. That trust needs to be there.
Yes, we can feel the same. I can sense the and feel the frustration of our public, our chat boxes, and our audience. And thank you for advocating and reshaping, rethinking, and reimagining drug stories. Thank you for sharing this message with us, and thank you for joining us, Mr. Howie Severino. It's been a pleasure. To be sharing this safe space and this virtual environment with you. I would like to say a few things about this. It is a difficult time for media, both here and abroad. We have to start changing the narrative, and I appeal to our press and to our people to be more compassionate in our language, to be compassionate with our people and our communities, our our friends, our neighbors, our everyone around us. Uh, Thank you for sharing the message with us.